Hello everyone. So today I'm talking about high-risk pregnancies. And one of the most common high-risk pregnancy is pregnancy with diabetes. So what is diabetes? As we all know, diabetes is uncontrolled blood sugar. When we talk about pregnancy, then diabetes in pregnancy can be of two types. Either a lady who is already diabetic becomes pregnant, or there are few girls who get diabetes when they are pregnant. So the diabetes which happens in pregnancy is known as gestational diabetes, and the other one is either type 1 or type 2 diabetes. So why are we worried about diabetes in pregnancy? We are worried because diabetes in pregnancy can affect both mother and baby. The harmful effects can be both, either on mother or on baby, or both. So what are the harmful effects in mother? So a diabetic mother is more prone to high blood pressure. There are more chances of frequent urinary tract infection in those ladies. There are more chances of delayed wound healing. Delayed wound healing means any kind of wound if she gets, she will take more time than usual to heal if the blood sugar is not controlled. Same goes for if she goes in cesarean section, then there are more chances of delayed healing of cesarean scar. There are more chances of vaginal infection. So overall, diabetes in pregnancy has many side effects on mother. Now let's talk about baby, which is more important when we consider diabetes. A lady who has uncontrolled blood sugar and is carrying a baby, there are chances of malformations in baby, which means structural defect in baby, number one. Number two, there are chances of growth restriction. There are chances of preterm birth. There are chances of macrocosmic babies or big size babies, and the ladies who are carrying macrocosmic babies, they usually land up in cesarean section because at times vaginal delivery becomes difficult with such big size baby. And last but not the least is intrauterine demise. That means at times there can be sudden demise of baby in womb. So what to do if a lady has diabetes? So diabetes in pregnancy can be managed very well by medicines and by meticulous and ritual follow-ups. So there are medicines, oral medicines which are to be taken by mouth, which can control blood sugar. Similarly, at times we need to give injections of insulin. So your doctor will decide when do we need to start injection and in which pregnancy we need to give injection. So what you need to do if you come across diabetes in pregnancy? So meet your doctor, plan your line of management, your exact diet requirement, your calorie requirement as per your weight and height, your exercise schedule, your medicines and your routine follow-ups. Your level 1 ultrasound, level 2 and other ultrasounds as and when required. You may need to go for an eye checkup or certain other blood tests which are slightly different from any other pregnancy. So be vigilant with that. Go for a timely follow-up, and if blood sugar is maintained, even if you are diabetic and if your blood sugar is well maintained either with medicines or with insulin, then the diabetes pregnancy fare really well. The chances of healthy delivery without any complication is very high if the pregnancy with diabetes is managed well and blood sugar is within normal limit throughout pregnancy. Once you have delivered, either normally or by cesarean, whichever method if you have delivered, then 6 weeks after your delivery, your doctor will repeat your blood sugar again. The ladies who are diagnosed with diabetes for the first time during pregnancy, they may have chances of diabetes later in life too. So they need to keep once a year follow-up. So if somehow there is a family history of diabetes, if you feel that you are a high risk for diabetes, please do share with your doctor. Stay healthy, stay informed. Thank you and take care.